Ladies and gentlemen, at this time, I would like to welcome Mcdonald Md, Chair of the Parkland Health and Hospital System Board of Managers. Dr. Mcdonald has had a heart for health care since the age of 15, when she visited her mother's hometown, and then realized at that time that not everyone has the same access to health care, but really should. A nephrologist by training, Dr. Mcdonald practices in Dallas, has received numerous awards for her work, her community service, and her social activism. Ladies and gentlemen, please welcome Dr. Mcdonald.
Well, good afternoon, everyone, and welcome to this momentous occasion. The good Lord has given us beautiful weather for this, and we're so appreciative of that. Well, 4 years from now, on this very spot, will stand a hospital that redefines healthcare. And I'm not saying this is a safety net hospital or a public hospital. It will be a hospital that redefines healthcare throughout the world. And because of you, this was able to happen. You made it happen through your votes in the November 2008 election, and also through your generosity. Now, the new hospital is truly a community project. Parkland is known for its firsts, and the Dallas area philanthropic community has donated to this project like they've never donated before. I know many of you out there have donated hundreds of thousands of dollars and millions of dollars, and we are truly blessed that your wealth has been able to help the Parkland patients. But I'd also like to say thank you to those of you out there who've given us $10, $50, $100, because no amount is too small to help us reach our goal. So thank all of you. Now, the new Parkland will not only dramatically change the profile of the medical district here, it will also change millions of lives each year. And the way that those lives are changed are through the Parkland heroes. And there's so many of you out there today. I'd like to honor a few. First of all, the honorary chair of the I Stand for Parkland campaign, Ms. Serena Simmons Connolly. Serena, please stand. Serena, we would like to thank you and your family for your generosity. I'd also like to recognize at this time the co-chairs of the I Stand for Parkland campaign, Ms. Nancy Strauss Halbrecht. And Nancy, I know you're out there. I saw you earlier. There you are. Thank you, Nancy. And her co-chair, Don Glendenning. Now, we are so fortunate today to have a long list of public officials, but because they're so important and worked so hard for Parkland, I would like to recognize them. First of all, we have Congresswoman Eddie Bernice Johnson. Thank you, Congresswoman, for attending today. And we have Senator Royce West. Thank you, Senator. We have City Councilwoman Pauline Medrano. Later on, we'll be hearing from Mayor Leppert and Commissioner Price. I'd also like to go ahead and recognize our county commissioners, because without them, none of us would be here today. County Judge Jim Foster. Commissioner Cantrell. Commissioner Mayfield. And my predecessor, who has given countless years of civic service. She was previously board chair here at Parkland, and now she's one of the commissioners, Commissioner Maureen Dickey. I'd also like to recognize members of the team that's building the new Parkland. Will each of you please stand? First of all, I'd like to recognize the Project Parkland team led by Mr. Walter Jones and Lou Saxon. All right. And at the board level, we call Mr. On Time and Under Budget. So we're very appreciative of those two gentlemen. Our master architects, HER Corrigan's team, led by Hank Adams, Matt Mooney, and Mike Moran. Are you gentlemen here today? Thank you. Walt Massey, David Graham, and their team from Barra, who serve as construction managers at risk. Please stand. The team led by GBA, Susan Logan, and they're the medical equipment planners. Miss Logan? There she is. Thank you. Our technology integration team from TCOM and Waywise, led by Laurel Taylor and Mr. Duke Hamilton. There they are back there. And Al Wynn's team from Critigen, and they're providing oversight of the multiple committees and the complex process. Are they here today? There they are. Thank you. We're very fortunate today to have a patient advisory committee. This committee is made up of former Parkland patients and their family members who look at our new project and give criticism, advice, so that we're able to make the new hospital more patient-centric and patient-friendly. We'd like to thank them for the countless hours that they've spent, because their comments allow us to make the new facility even better for the patients that we serve. We have a facility advisory committee, and they're a group of community leaders who have lent us their professional expertise to improve the hospital. And these community leaders have just served us tremendously, because we've been able to make a better hospital, but at the same time, save some of the taxpayers' money. So their advice has been invaluable for us. Now, I'd like to go ahead and recognize our current and former board members, because they have spent countless hours away from their family and away from their professions to donate to the hospital. I've mentioned Commissioner Dickey, but I know that former board chair Cliff Boyd, you're out there. Cliff has served, thank you. Cliff has served as board chair and also on our Blue Ribbon Committee that first kind of put together some of the ideas for the new facility. There's also Gary Wood. Gary, thank you. There was a time when the board was somewhat tumultuous, and it was Gary, myself, and Mr. Dalton Lott that kind of held it down for a little while. Now, our current members, and again, they've spent so much time. I've mentioned Mr. Dalton Lott, Dalton, so we could acknowledge you. Ms. Kobe Russell. We have our vice chair, Mr. Alan Wallen, and his wife, Joan. Thank you. Mr. Louis Vitro. Thank you, Louis. Mr. Chris Luna. And one of our members who could not make it today, Dr. Chad Park. We are very, very appreciative of all the time that's been spent by the board, truly. Oh, thank you, Nancy, thank you. We have Congressman Dan Branch. I'm very sorry, I didn't realize that you had arrived. Where is Congressman Branch? Dan, thank you so much. I know many times we visited you in DC, and he's been a solid Parkland supporter. I apologize for the oversight. Now, before I turn this over to Mr. Murray, I'm going to tell you a secret, and he doesn't want me to say that. But believe it or not, in this tent, you have two people, myself and Mr. Murray, that are from the booming metropolis of Rochester, New York. So I don't know what that really means, but I'll hand the show back over to you, Scott.
Dr. McDonald came up to me as we were getting ready to come on the stage, and she said, "Aren't you from Rochester, New York, Scott?" And I said, "Well, many, many, many years ago, I went to the University of Rochester. I haven't been back there since, except occasionally go back and see my mother, who was actually born and raised in Alabama. So she loves the fact that I live in Texas." And she said, "What were you doing up there? Where'd you go to the..." I said, "I was studying to be a pediatrician at the University of Rochester." Don't ask me where it happened, but about a month before I was supposed to go to medical school, I was given an opportunity to do some television, because I've been doing some TV commercials and some radio sportscasting, just as a kid when I was in college. And that's how I ended up here telling scores for 30 years. Go figure. But thank you very much for your kind thoughts.